A homeless and asylum seeker Bob in San Francisco City. At first sight, Bob may not have thought about his significance for occupying a cabin meant for the security guard at the asylum's reception area, let alone extending the bald ribaldry sketches as a gesture of welcoming residents to the premises of a confined meshap. On second thoughts, he may have reminded us of an overcrowded metropolis that stood outside knowing nothing of Medicare facilities and about planned health care that went berserk at the fragmented thoughts of a few challenged ones who once upon a time belonged to the well adorned social class. Bob says he likes to watch TV in his free time from a silent quarter far away from the Faraday cage, inviting as little attention from the asylum wanderers, of whom he says some are businessmen and some of whom are from the glorious industries. Competing medical resurgences find compelling reasons enough to push male-valent symptoms of homelessness. Some head towards as detached asylum seekers, leaving the sycophancy at the doorsteps of stacks and riches. Bob cannot remember the decisions that day, what prompted him to take the first steps out of a recovery bed that made him realize of imminent idiosyncrasies on liquids than of an immediate one waiting at the half-open sidewalk. The day he was an asylum seeker, he remembered about the nightingale or caretaker who was apprehensive of the well-bloomed floors and the mirror-like finish of decorated tiles, making the ornamental design an absolute must for transparent orders and odorless wines. With a pronounced indifference to dominating attitudes, the nightingale routinely delivers lectures on table etiquette and manners that ought to exist before taking medication that are samples of conceptual drugs to control cub instincts and wheat makeovers. On bluegrass and red herrings cravings, Bob felt flamboyant affluence of oratory dementia that went on affecting him and a few patients had nothing at all to do with insurance cycles, conforming to recuperated aspects and pragmatic views. In Bob, it may have meant guts to overcome depressive but elusive outbursts, quite often of eagerness and uncertainty of homeless burdens, make him unsure of repetitive calls from sequestered quarters proclaiming separation, settlements, shut doors, and a policy. Rendezvous, doesn't it feel better? Cries ELISA, an asylum seeker from next door, when the distorted alphabets lie wonderfully crushed with its deformities and analogies in retrospective, indicating quagmire symptoms emerge as an analogy or riddle for the framers.